All right, everybody, it is 5 o'clock, the time we come together every day and make sure that we have the physical, mental, and emotional strength to defeat the coronavirus. It's a challenge of our times, but you are up to it. And while, and you'll hear today, we have substantial loss. There are far too many that have been taken from us. We are flattening this curve. We are winning this fight. But the challenge of our times is not supposed to be easy. So let's make sure, as we work on moving into the future, that we are smart and that we do it safely. We don't have to do something first. We just have to do it the best. And that commitment and your resiliency and your strength is why we will get through this, and we will get through it together. Let's say it together. We will get through this. We will get through this together. One more time. We will get through this. We will get through this together. And we're going to get through this together because we have been committed to the 10 steps that it takes to defeat the coronavirus. We talk about them every time because we know if something becomes a rhythm and a regular part of what we do, that it almost becomes muscle memory. That being healthy at home, we know is our patriotic duty as a Kentuckian and as an American. That by being healthy at home, we protect all the frontline workers that are out there, we reduce the spread of this virus, and we reduce the number of deaths. We're not going to show it right now, but just as an example, that COVID Act Now graph, that while we have beaten that model, I believe, significantly, was saying that there could be the difference between 11,000 people that we would lose if we are committed to social distancing or not. You have risen to the challenge, and we got to keep it up. There's light at the end of the tunnel, but we're walking through the tunnel. We're not on a train going through the tunnel. So while that light at the end of the tunnel ought to be encouraging, remember that we got to take one step after another to gradually get there. Healthy at home helps us get there faster. We're going to talk about this in detail, but if we stop being healthy at home tomorrow, we would be going through this a lot longer than if we are willing to keep it up. Avoid crowds and gatherings, practice social distancing, know when to seek care, make sure you get your news from real sources. Wash your hands, don't cheat, disinfect surfaces, apply for benefits. We are working to do better each and every day. Prioritize your mental health. We are a month plus into this. This might be one of the most challenging of all of these, but we've got to be strong. Remember, the greatest generation faced years. We're being asked to face months. We're tough enough to protect our fellow man and woman and pass this test of humanity. Don't travel. And especially as we'll talk about, when other states are making decisions that are reckless, that I believe will cause a spike that will prolong this coronavirus in their state, we cannot travel and make other people's poor decisions impact us. Finally, report non-compliance because that helps us ensure that everybody's on board and doing the right thing. We always talk about the 10 steps plus one. Fill out your census. We went up 1 in the rankings. We are now, I think, 16th in the country. We're a lot better than 16th. None of us ever wanted to say, yay, we're 16th. So please, if you haven't done it, do it. It is a legal obligation. It will help your state, and you're committed to helping your state. You've shown it. You're willing to do it. This is important. Please fill out your census. All right, the other thing that we've asked you to do each and every day is to take this duty that you feel, the good things that you are doing, positive things that you are doing, and they want to do them too. This is the type of positive social pressure that helps us save lives. So let's look at a little bit of what we have today. All right, this is 100 years. Happy 100th birthday to Bill. Bill is celebrating this healthy at home. How many people have a 100th birthday? It is an amazing mark. It is something that people would want to celebrate together. But Bill, this is his church, and his family know how important healthy at home is, and they want him to hit 101, 102, and 103. Happy birthday, Bill. Thank you for helping us remember that the moments that we miss, they're tough. They're tough. But your willingness to set the example is so important. All right. I love this. Our frontline workers talking a little bit about what makes somebody a hero. And we talk about how they're a hero in these times. They have been heroes all along. Maybe now we just appreciate what so many people, do. And you know, if we can come out of this, not just being better people, but appreciating what everybody contributes to the greater good, that'll be a good thing. All right. This is, again, communication, residents and families, especially for our seniors, that even when we are coming into phase 1 and even phase 2 under the White House's plan in reopening, are still going to have to be healthy at home. So these virtual options of communication are really important. And what I would ask is whether you are one of our seniors in one of these facilities, whether you have a parent or a grandparent there, do this regularly. Set a schedule. It's important to everybody's mental health, and it'll help us get through it together. All right, this is just creative ways that everybody is dealing with the special moments that they are missing. You know, we talked about the fact that a lot of our seniors are going to miss prom, are going to miss graduation. My son is going to graduate from elementary school. He's not going to have an in-person graduation. But we have things like the father-daughter dances that people were looking forward to. My daughter had a recital. So many different things that we're missing, but you know what? Find ways, like this family, to make sure that we're just doing those special things, not just to help our kids with them. It helps us as well. Look at a smile. I mean, you can't fake that. These are the moments that help us get through. This is the Graves County Courthouse. It's lit up. Graves County, all of Western Kentucky, has been hit really, really hard and are going through a very difficult time right now. And we'll probably talk or answer questions later about decisions that other places are making. We've got to make sure that as we work to reopen our economies, that we are safe. And right now, so much of Western Kentucky are seeing cases like this right now. We got to do this right. We got to do it in a way that makes sure that we don't have to light our courthouses up green for any longer than we absolutely have to. Yeah, and again, this is one of our schools missing its students, but understanding why we're making the sacrifice and showing the compassion for it. All right, so today from social, we're going to go right into new cases because we did some things today to honor those we've lost, and we've lost a lot of people today. And I think by doing it in this direction, it's going to help not only guide all the updates that we do, but it's the right thing today. So, you know, we always talk about we always seem to have some good news and some tough news. The good news today is we're reporting 177 new cases of the coronavirus. That might sound strange that you think 177, but when we 2 days ago had our largest number to date, again, we believed it's because some labs take 10 days, some labs do 48 hours, some labs do 12 hours. And so it's really hard for any one day to be just about that one day. So what we're really looking at are averages. And this suggests that over the 3 days where one day we had a really high number and one day we had a lower number, And now today we have the 177 that we have, in fact, likely plateaued. It means we're not on the increase, and we're not yet on the decrease, but especially given that we're a month into this, it at least lets us know where we think we are, subject to what we learn every day. Total number of tested, 33,328. That's going to jump significantly. Tomorrow we're going to spend almost all of the day talking about additional testing sites and capacity. Tomorrow is going to be almost exclusively about where we are in testing, how we're going to increase that capacity, and where we're going. Ever hospitalized in Kentucky, 1,076 Kentuckians. Currently 286 Kentuckians. Ever in the ICU, 558. Currently 165, a little bit lower than we've seen on some days, but still 165 Kentuckians. Really important to be thinking about them. Number of recovered, 1,266, and we are grateful for that. New cases by county, 71 in Jefferson, 32 in Hopkins, 16 in Kenton, 11 in Warren, 5 in Boone and Graves, 3 in Henderson, 2 in Butler, Campbell, Fayette, Marshall, and Shelby, 1 in Anderson, Barron, Caldwell, Callaway, Clark, Grant, Hardin, Hickman, Jessamine, Laurel, Lyon, Martin, Mercer, Muhlenberg, Oldham, Perry, Pulaski, Rowan, Russell, and Simpson. Again, we know that the coronavirus is everywhere. With so many people being asymptomatic, we know it's everywhere. So we have to continue to keep up being healthy at home, knowing that we are on track to defeat this virus, but knowing that every decision that we make matters. Every good decision we make protects people. Every bad decision we make can result in the loss of people. So today, I have to announce that we have lost 17 Kentuckians. And 17 is a hard number to take. We knew that there would be days where there were significant numbers of Kentuckians, but these are 17 individuals that are going to be missed, 17 families, 17 communities that are going to be grieving in one of the most difficult times with the lack of being able to be together that we could have ever imagined. These 17 individuals are more than ages and genders and counties, but that's what I have to read to you every day. 17 individuals are an 86-year-old female in Lyon County, an 81-year-old male in Butler County, a 73-year-old male in Kenton County, a 92-year-old male in Graves County, a 93-year-old female in Kenton County, a 58-year-old female in Grant County, a 90-year-old female in Graves, an 85-year-old male in Hopkins, a 71-year-old male in Jefferson, an 80-year-old female in Hopkins, 81-year-old female in Hopkins, a 52-year-old male in Jackson, a 94-year-old female in Graves, an 81-year-old female in Jefferson, a 90-year-old male in Hopkins, an 80-year-old male in Hopkins, and an 81-year-old male in Jefferson. Let's make sure that we're doing everything we can to not have days like today, knowing that even when we start seeing this decrease, and we will, we can see light at the end of the tunnel. It is still really deadly, especially for those in our senior living facilities. And while we are all ready to get to some type of new normal, these are people's family, and we got to do this safely. We got to move forward safely. People are counting on us, and we lost 17 people today. And while I imagine that there will be still some days worse than this, I don't want there to be many, and I know you don't want to either. And I want to remember a specific individual today, and this is really hard for this family. His name is John Doug Woods. Just a couple days ago, I talked about the loss of Frida Woods, a beloved wife, a mother, and a grandmother in Hopkins County. We learned Sunday that even more heartbreaking for this family is that her husband, Doug, had also tested positive. And the coronavirus has done something unthinkable to this family. They've now lost their grandfather, John Doug Woods, both their grandmother and their grandfather, taken in 2 days. It's not supposed to happen, and I cannot imagine their pain. We learned on Sunday they would have celebrated 64 years of marriage this summer. And this family has lost a father, a grandfather, and a great-grandfather. They knew him as Grandpa. He is also a veteran. Doug, who is 90, served in the U.S. Air Force. It's just too much too soon, one granddaughter wrote. She said, "You will forever be my favorite veteran." For Doug and for Frida, for their family, and for all other Kentucky families that are hurting today, our hearts go out to you, and we will light our house screen for you and for everybody else as long as it takes to get through this. I'll give some of the other statistics, but today we did a ceremony after we had lost 150 Kentuckians, and now we are up to 171 that quickly. Today we honored them by having our KSP Honor Guard place a wreath in our Capitol Rotunda as we rang our bells at 10 a.m. That wreath was placed at the feet of Lincoln to honor those we've lost. I hope all 177 families and communities view this as a way to honor them. Let's watch it, James. And just like those that have to grieve and grieve in different ways for lost loved ones, that was done in an empty rotunda. But I hope it is meaningful and shows those out there that have lost loved ones that we care about them. A loss of any Kentuckian is a loss to all of us. So our total number of cases that we can confirm of the coronavirus here in Kentucky, our official number is 3,192. And the racial and ethnic breakdown, which we're going to report every day, we know 77.23% of the racial data of all known cases, 76.91% white, 13.56% Black or African American, 4.23% Asian, 5.24% multiracial. On ethnicity of all cases, we know about 72% of those 92.57% non-Hispanic, 7.43% Hispanic. On deaths, we know about 84% of the racial data. That is 78.47% white, 19.44% black or African American, 1.39% Asian, and about 2/3% multiracial. On ethnicity, 99.29% non-Hispanic, 0.71% Hispanic. Our announcements tomorrow on testing, I hope are going to give people confidence that we are taking this very seriously, and we want to direct resources at a time of a pandemic where we are seeing disproportionate harm. That announcement will be tomorrow, and I hope will be viewed as significant. It'll be some of the strongest steps in the area that we're going to be talking about that have been taken. All right. So as we move into the rest, we always learn a little bit of sign language, and I know today is a little bit hard because of both what we've lost and how we recognize people. So if Virginia would, I'd love for us to learn green for compassion. Green for compassion. Show us one more time. Green for compassion. One more time. Green for compassion. So let's make sure tonight that we have more green lights out there than ever before. And tomorrow, let's ring our bells at 10 a.m. All right, I want to talk about first where we are. And, there are a number of different public sources out there that are trying to track data in a number of different ways. I wanted to show you from one of those public sources, new case, really by week data, and what that's showing about Kentucky. So first, this is just a rate. So we're going to talk later about when we use our benchmarks. It's not just number of overall new cases, it's also the rate, because as we test more, we're going to have some more positives, but what's the percentage of what we're looking at? Are we seeing the virus on the decline or not? And so this gives us at least one other way to look at it. First, look at where we are versus a state, say, like New York. But here I think what you see a little bit is the plateau. Again, nothing is absolutely flat, right? It's going to go kind of up and down on any given day. I mean, if one lab takes 10 days and another lab takes a day, the data's not perfect in how it looks. But look at Louisiana. So Louisiana had more of, especially in New Orleans, that Philadelphia peak. They got hit really hard. And what you're seeing, at least there, is a little bit of their rate going down. And this is just one example, but what Dr. Stack and I are going to be looking for as we go through those benchmarks is when do we see, a rate of new cases not kind of on a plateau going up and down, but when we can actually see that it's declining. Really important, but even with our record number of cases, 2 days ago, if you look at the last 2 days now, again, we feel pretty good that we have not only flattened the curve, but that as opposed to a regular curve, that we are more at a plateau. I think I said the other day that we've cut the top of the muffin off. I mean, it gives you a way to at least visualize where we are, and that's your work. That is your work. It means even with the 17 we've lost today, you've saved lives. That would have been a significantly larger number. We need you to keep it up. This thing can spike upwards at any minute, and let's make sure that we don't let that happen. Want to show you an oldie but a goodie, and that is St. Louis versus Philadelphia. So by this point, we know that with all of the work that you have done, we're not Philadelphia. I don't know how many days I spent saying, let's not be Philadelphia. Let's be more like St. Louis. So now that we know we're not Philadelphia, let's look at St. Louis. And let's make sure we're better than St. Louis. So what St. Louis teaches us is we are right now, we hope, at kind of the top of that we have plateaued it because we had better information, and we are more committed to protecting our fellow human being than I think that we have seen. And so if you think about that and where we are, the challenge that we have is to make sure that as we start reopening our economy, that we don't have that secondary spike. And it's for a couple reasons. And in a minute, I'm going to play you Dr. Fauci, who's the national expert. But what he's going to tell you, and what's the truth, is it's not only is that they lost more lives in the second spike than the first, but it caused them to shut down their economy for longer. Because if we can take, that first wave and do this smart and continue to make sure we're strong and resilient, that first wave would go straight down and we would ride this out. And if that first hump went straight down, then the impact on our economy would be for a shorter duration. And so making sure we do this right and not having the second spike means the light at the tunnel is closer than it's otherwise going to be, that we don't take 2 steps forward and 3 steps back. And so just looking at this, we've got to know that our commitment has to be, yes, to be ready and to plan, but to make sure that we do this not the fastest, but the smartest and the best to protect our people and to make sure that ultimately when we look at the long-term reopening of the economy, that we end up doing it in a shorter duration by not making some foolish or some very risky decisions. Let's play the video of Dr. Fauci the other day. This is him answering questions about following the White House guidance that we've talked about and how important it is, as opposed to just flipping the switch.
If you jump the gun and go into a situation where you have a big spike, you're going to set yourself back. So as painful as it is to go by the careful guidelines of gradually phasing into a reopening, it's going to backfire.
All right, so this is everybody's scientific public health guidance, that how we do this has to be data-driven. It has to be well thought out and well planned, and it has to happen in phases. That is how we protect those around us, continue to pass the test of humanity, not frustrate all the sacrifices we've made, because you have. I mean, you've passed the test. We don't want to fail it on the back end. But it is also how we do it right, how we come out of it strong, and how we're only dealing with this for months and not for much longer because of a big additional spike. So we're always going to talk to you about where we are on the guidelines. In fact, we're going to try to put some real metrics on that on Thursday so you can follow along. But let's be committed. Let's be committed to not being the first, but being the absolute best, knowing that not just the lives of our people, but the strength of our economy is based on it. And I know we can, and I know that we will. So with that, and just thinking about how we have to do it right, let's go through a little bit of the benchmarks, and I'm going to fill in on a little more information on where we are and do some of our normal updates within the benchmarks. First, 14 days where cases are decreasing. That's the number and rate of new cases. Remember, this isn't our guidance. This is the White House's guidance that everybody agrees. that this is what we should be doing. Some states may not follow this, but if every public health official tells you it's what we ought to look for, there's a good reason to follow it. And so I think the graph that we showed you, it has some bad, but some really good news. I guess the bad news is it doesn't appear that we are on the decline just yet. But the really good news is it appears that we're not on the incline yet either, that we have plateaued, and now what we look for is that beginning of declining. And I will tell you, we won't know it the day it starts. It'll take 3, 4, 5 days of data to say, oh yes, based on the averages because of the delay in getting results, that yes, we are moving in the right direction. So remember, this is important. We're going to be able to take some small steps potentially before we have the full 14 days. And a lot of the steps we're going to be able to take are in our healthcare industry because of the ability to control and even treat and care for COVID-19 patients. It's a controlled environment that we can learn from. And like we've done everything, including our drive-through testing, having some proof of concept is always very important. All right, increased testing capacity and contact tracing. Tomorrow, we're going to talk about significant increased capacity and how we're going to use it. But we still have a long ways to go from where we are tomorrow. But where we are tomorrow is a heck of a lot further than where we were a week or 2 weeks ago. So we had 4 sites up today, 4 drive-in sites. Think about as long as we tried to make that happen. We had 4 across the Commonwealth open today. Paducah, as of 4:30, had seen 138 people. Let's increase that tomorrow. Let's make sure we're getting people tested, everybody tested. Pikeville had 118. Madisonville had 226. Somerset had 201. So you look at just that amount of testing, about 700 plus on top of anything we were doing before and in different regions of the state. That's very positive. We also have 2 other areas testing with some supplies that we have been providing. So Callaway County and the city of Murray are testing through Murray Callaway County Hospital. They began an on-site drive-up test today. So another drive-up area that's been created. They're providing testing Monday through Friday in an effort to promote expanded testing in Western Kentucky. This testing has been made possible with the state. We are providing them gravity diagnostic kits, and they're able to use our partnership with UPS to ship them. So if you are in the area, call Murray Callaway County Hospital to be screened for testing at 270-753-0704. 270-753-0704. And as we really roll out now the different options for testing that we're going to do tomorrow, we'll make sure that we have that information up and on our website so people can see it. Okay, another new drive-up testing site. The Kentucky Department of Public Health has partnered with the Christian County Health Department to provide drive-through testing for up to 70 people a day at Tiebreaker Park in Hopkinsville. Testing is available for emergency workers, first responders, healthcare workers, and anyone exposed to COVID-19 patients or anyone in the community experiencing symptoms. Individuals who'd like to be tested will be screened at the park prior to testing to make sure they meet that criteria. This is a partnership with neighboring health departments, including the Pennyroyal District Health Department, Todd County Health Department, Muhlenberg County Health Department, and Hopkins County Health Department to make sure that there is more testing in the region. And tomorrow, there's going to be a number of additional announcements that are going to represent our most significant effort to date to increase testing. Personal protective equipment. To give you an update, we have made here within the state what we believe is some significant progress, though we have more to go. This was as of April 14th. And I'm proud to say that in just about all these areas, except where we've been shipping out, some where we had a significant amount, we have seen significant gains. So just in the last week, more gloves, surgical masks. Yeah, so the surgical masks have, can you back it up? I didn't do that very well. All right. So we've gone from 4.2 to 4.5 million gloves, from 335,000 surgical masks to 1.4 million, 153,000 face shields to 445,000. I will tell you, Kentuckians are doing a great job of manufacturing these, and they're going directly out to the healthcare facilities. Gowns are tough, 37,000 to 37,200. This is one of the newest, most difficult areas. Respirator masks increased significantly. These are they're broken down a lot more KN95s and a decent amount more N95s. This is the toughest area and where we need to get to be really comfortable. And coveralls have gone from 5,000 to 9,000. This wouldn't have happened 2 weeks ago. I mean, 2 weeks ago, those gains were not possible. We need a lot more. And when we look at what we're going to be able to do as a state and the speed we're going to be able to do things, it's not just what we have, though this is kind of an example of where we've gone in a week. It's really what our hospitals and our private employers are going to be able to obtain through the private supply chain. That's going to be important. And one of the things we're working with on our hospital systems is their ability to stockpile and how many weeks worth of PPE they're going to need to have to prepare for a surge, to begin doing other visits and other procedures, which we want to start opening up when it is safe to do it. All right, ability to protect our long-term populations. And this is how important this is. James, will you actually just go directly to the long-term care facility slide? This is a tough one every day. And I will tell you that everybody out there is working their hardest. This is a disease that attacks our most vulnerable, and it is so contagious. So everything we do and we think about, we've got to look at the risk, especially here. We have 46 additional residents since yesterday that have tested positive for COVID-19. We have 12 new staff from yesterday that are tested positive, and we have 13 new deaths from yesterday. So when we read those deaths today, most of them are from our long-term care facilities. And I don't think this means that people have done anything wrong. We're all responding as quickly as we can. We're gonna provide a significant amount of our testing capacity that's not necessarily being used at the hospitals we're sending it to these nursing homes. We've got a new hotline with Norton's that they're using. We're developing teams that can work directly with them. We have a new overall task force in the state. Every day we're working here. But this, we have to be thinking about as we continue to deal with this virus going forward. Every decision, every business that we're able to open, what is going to be the impact, especially on our most vulnerable. Ability to socially distance and follow Centers for Disease Control and Prevention guidelines on large gatherings. All right, just because we want to be able to see, and this is back in our benchmarks, that decline, doesn't mean we shouldn't be preparing now. We should be. We want to make sure once we hit that mark, knowing that we might only know 5 days in, that we're ready, and that when it is safe to do something, we can immediately start doing it. And let me say, I believe our businesses out there, they are with us. They are with us. They want to do this safely and responsibly. I had a call today with a large number of Central Kentucky businesses, from some of the biggest to some medium size and to a person. They want to develop the practices and procedures, gradually phase in, do this the right way to protect their clients and their business. So what we're going to be asking for are our industries, our association groups, and some of our individual businesses to submit plans directly to us on how they believe they can follow the CDC guidelines and the changes that they're going to make in their operations. And let me say this, our new normal is not the old normal, that every plan has to be really different than what regular operations looked like before. So our group here that's going to be accepting Those are going to be made up of my Chief of Staff, Latasha Buckner, Jim Gray, our Transportation Cabinet Secretary, Larry Hayes, our Economic Development Cabinet Secretary, and our Labor Cabinet Secretary, Larry Roberts. They can be submitted to a website that we are creating, James, if you've got that one, and to an email that we have created, which is healthy at work. Like we have to be healthy at home, we need to be at healthy at work. And so that email address is healthyatwork@ky.gov. So we want our businesses thinking about this, getting ready. And here are a couple things that I wanted to throw out there that they need to consider and put in actual plans, because these are within both the White House's plan and some of our guidelines. How will you socially distance? What will it look like? You know, there are no waiting rooms anymore. That just brings people together as one example. Telework should continue with everybody that can telework. Temperature checks, how you handle symptomatic employees, testing and contact tracing, what your ability to do that is, supplementing the state's ability, sanitation, closing of common areas, limitation of travel, phased return, and accommodations for at-risk population. I'm going to ask my Chief of Staff, Latasha Buckner, to speak just a little bit about how we see that coming together, and she will be one of the individuals working directly in a back and forth with those that submit plans. And I took all your notes.
You did. It's okay, you can do that because you're the governor. So the governor got some of the key points that I was going to talk about, but one of the things that's really important is this is going to be a dialogue with your business, your trade associations, employee groups. We're going to be meeting this week, talking, of course, by Zoom or some other format with your mayors and your local county judge executives. We want the input, and we want the back and forth. We want to come up with a really good plan that's workable. He's hit some of the really big things we're going to be looking at on the website when you submit your plans. We want to know that you have something in mind for people who are in vulnerable populations. Those are special accommodations for people with chronic disease, elderly, immunocompromised. How are you going to report your positives? Do you have a plan for sick leave or quarantining employees? Something that's going to be super important is probably masking employees, and if you're forward facing, having masks for customers as well. It's going to be a phased-in report. We want to make sure that where you can, you're still teleworking. You're limiting outside travel for your business as well. Less face-to-face meetings. And we're all going to be working together on this. We want to make sure that we do it the best way and not just the quickest way. Thank you.
And doing this right isn't just about safety, though that's our number one concern. It's also the right thing for the economy. Avoiding a second spike will restore our economy faster, and a second spike will cause significant damage to any business or any industry if there is a widespread outbreak, especially among their employees. So the last two pieces on our benchmarks: preparedness for possible future spike. That's something we'll be working with our healthcare community, and the status of a vaccine and treatment. That, of course, will be the game changer that hopefully moves us from a new normal to something more like a normal that we know. A couple other areas that we update every day. Western State Hospital is the same as yesterday. Rotor is as well. No new cases in either area. Hazelwood, I've mentioned because it's a state-run facility. It is not a correctional facility, and I should have made that clear. It is a facility that helps those with developmental disabilities, and I want to make sure that everybody is safe and protected there, but never want to suggest that it is anything other than what it is, and is providing the great help that it does. Green River Correctional Complex, one new case today. which is one new inmate. All right, we got about 15 minutes left. We got a series of questions. We have 4 reporters with us today: Karen Czar, Philip Bailey, Phil Pendleton, Joe Ragusa, and I'm going to go back and forth between them and the questions that we have. We'll start with Karen.
This is for Dr. Scott. The LabCorp home testing kits that have been approved by the FDA, if Kentuckians can even get any of them, what are your concerns or any advice you have for people who want to go that route?
Thank you. So the question is about LabCorp home tests, and I actually haven't reviewed that particular one, but I'll give you a general answer for it. I think home testing probably does have a place at some future point in time. That's obviously one of the first ones being or attempting to do this, and LabCorp is obviously a large laboratory provider. So I would say stay tuned, and we'll just have to see how that unfolds, because it's not just the test, remember, it's the medical advice that goes with it. So my question would be, has someone sought appropriate medical advice, determined that the test is clinically useful, and do they then have the necessary medical advice to make proper use of the test result? So I wouldn't just get the test without making sure you have a clinician guiding you in how to use the information.
Thank you. So calls that we've received about the additional $600 in unemployment from the CARES Act and when people might receive it. There are 2 reasons why someone might not have received the additional $600 yet. Number 1, we're running about a week behind, so there is a little delay. But number 2, the $600 payment is made after the first UI payment. These typically take some 1 to 2 days after the very first payment comes in. It's important to remind people not to refile a claim or to file a new claim if they have already filed one. It's delaying the UI payment, is delaying the $600 payment. Again, we're dealing with an unprecedented number of claims. It doesn't give an excuse if you haven't been helped, but we can get to you faster if they're not being refiled. Joe?
As we're talking about testing capacity increasing, how concerned are you about seeing a sort of second spike or an increasing number of cases with that increased testing? And how concerned are you about that needing to push back plans to kind of reopen businesses and things that people are getting antsy about?
The question is, with increased capacity, am I worried about a second spike and what that might mean on reopening? As we increase testing capacity, and especially if we reach the point where we're testing asymptomatic people, we would expect to see more positives. And at that point, we won't be looking at just the overall number of new cases. We'll be looking just as much at the rate of new cases amongst the population that we're looking at. So the increase in testing capacity is a good thing. Every day that we increase our testing capacity more and we can sustain it is a day we're closer to being able to do even more in our economy. And so it's more complicated analysis than just we had X number of cases on this day. And even right now, if the capacity stayed the same, it's more complicated than that because of the timing of when you get it in. If you have a LabCorp that's taken 10 days and you have a Gravity that's taken 48 hours, they're giving us different glimpses in time. And that makes the data difficult even on that end. Another state's public health director commented on the specific classification of a COVID-19 death in a state media conference, stating the labeling of death is very simplistic, meaning if a person dies while testing positive for COVID-19, even if there are clear other causes of death, that death is counted as a COVID-19 death. Is that true for Kentucky's cases? Almost everybody that has died and that we have attributed COVID-19 as a cause has had comorbidities. That's not everybody, but that's most people. And that's what this disease does. It comes from people who already have some underlying health condition, and it adds on top of it. We believe that it's the right thing to do for their families, and given that at the very least this virus hastened that death to count it as such. People may think it's simplistic. I just think it's the right thing to do. It's how we fight this disease in the right way, and everybody deserves to be counted. Yeah, there are other reasons, but those other reasons existed before this. And so I think this is the right decision in how we respond. Phil? Phil and Phil.
The University of Kentucky, I think, announced some furloughs today, and that's, well, I'm sure we're going to see more of that across the public sector. Is that something that the state may have to do also, or layoffs, or state workers being furloughed? Is that something that you're planning for or considering? What's the status of that?
The question is, with UK's announced furloughs today, what is the state looking at? We're going to have some announcements very soon on that. But the coronavirus has significantly impacted budgets of not just private business, but all public entities, every single one of them to a significant degree. And I'll just give you the easiest example. If you push tax day back from April 15th, which falls in this fiscal year, to July 15th, then you're going to lose a huge amount of revenue. Every single state and every single county and every single city will tell you that without significant federal aid directly to those entities, that it's going to cause us to take drastic action, which is going to further hurt our economies. We need a couple things from the federal government. We need their assistance to business, their assistance to individuals. We need direct assistance to state, county, and municipalities. And we need a very significant infrastructure bill that can directly help with this economy as we are moving forward. And I believe that Congress is considering those at different levels. But there is no question that our economy will not rebound as fast without direct assistance to states, to counties, and to cities, because while we received a significant amount in the CARES Act, it can only be used under the guidance they have to address COVID-19, and we're going to use it. We need that money. And I appreciate that money, but there has to be another step. Are the states for veterans nursing homes included in the daily update, and have any cases been reported at them? They would be included, but so far we have no cases of the coronavirus in those facilities. Phil.
Governor, how are you? Wanted to ask, in terms of the testing, right, how far away from the testing do you think we are in what we need as far as these new sites opening? Are we 1/3 of the way there, half of the way there, 1/4? Where are we as far as testing?
The question is, where are we overall on where we want to get in testing in the state? So if we do this right, let's say next week, and we have about 12,000, which is additional capacity from the last 3 weeks that we are using from our first group with Gravity, and we have another 4,000 from our drive-in testing facilities, and we're working on top of that. We'd be about a fifth of where we would want to get on any given week to do the testing per day that I think Dr. Stack mentioned the other day. Somewhere on that, we have he's saying kind of. We've got, it's really, I hate to say it's where we are in the journey, but our testing capacity has increased dramatically in what we were able to do, though it's got to be fully deployed. But we have a long way to go from there. But our benchmarks aren't exclusive, right? We don't have to hit all 7 benchmarks at the same time for us to be able to take certain steps with the economy. Dr. Stack, he's going to correct everything I just said, other than the benchmark piece.
Well, thank you, Governor. People already tease me that I say it in an incomprehensible way, and then you break it down into ways that make sense. So here's the problem with the testing. It's going to change over the next few months. So we do tests that we check in your nose or your throat or saliva. That'll all change, but to find out if you have the disease. And then we're going to get these antibody tests that are going to help us tell if you've had the disease and if you've been infected. And if so, have you recently been infected or have you gotten over the infection? So it's going to change. But right now, today, with the tools we have available, I would say that the testing capacity we have is probably only about 1/3 of what we need it to be, maybe 1/4 of what we need it to be. So you were close. You said about 1 in 5. We're about 1/3 to 1/4 of where we need to be. And so we've got to ramp it up quickly. But remember, all the hospitals and the doctors and the clinics were told we didn't have testing, which is true, and we still have resource difficulties to be able to deploy it. So now we have to fix the resources and then get them all to change what we told them for the last few weeks, which is now test everybody if we can, which is a 180-degree turn, and that's just the nature of an evolving situation.
And can you put up the Kroger sign up? Speaking of that, we need to make sure that in the areas that we're testing, Paducah, Pikeville, Madisonville, and Somerset, where we have 2 extra days now, that we have as many signups as we can. There's still capacity. We need people to sign up. So at this point, if you are interested in a test and you are in those regions, sign up. We would prefer that you think you have been exposed, or have great concerns or are symptomatic. But at this point, we want to make sure that we use that testing capacity. With the announcement of opening of Tennessee business, is there a concern about the economic impact for counties that border Tennessee? Many counties in this region are showing either no increase in confirmed cases or what could be considered a leveling off. Is there a plan for a county-by-county phased reopening? We're going to be talking to all of our county leaders, but if you looked at our map here in Kentucky of where we've been hit, there are a lot of western Kentucky counties very close to that Tennessee line that by portion of population have been hit really, really hard. And if the argument is, say, the 2 counties between the gray and the red haven't had that many cases, no, they have them. It's just a matter of testing and or the reports are coming out from other places. And remember, look right over the border, right? This is a problem. Again, it's not about being the very first to do something. It's about doing it the best and doing it the right way that ultimately protects our people. You do something too fast, you have a spike, you're going to be dealing with this and your economy is going to be reeling from it from a lot longer. We are committed to reopening our economy in a safe and effective way that is positive for our people and for our jobs and our business. I'm going to try to move faster. Karen.
Our other reporter, Josh James, is our Healthy at Home reporter, and he just texted me one for Dr. Stack. Are there potentially long-term health effects of this virus that we know about yet? And could you talk about your biggest concerns about other types of damage this disease might cause?
In 30 seconds.
Yeah, so the answer is we don't know. So this is obviously difficult on people's lungs, and the concern would be if there be damage there. It's been difficult on people's kidneys, and we've had people who've needed kidney support during the illness. So the answer is we really don't know for the long term, but obviously that's a concern.
All right, and trying to answer a couple of these very quickly. There's what's a rational timeline for high school competitive sports to return with or without fans? Without fans, the fall may be possible. We need to look at where we're going and what we have seen, and also what times things would start. With others reopening, am I concerned about travel? Yes, I am. And so our travel ban and the requirements about people who come in the state are going to stay in effect with, of course, the exceptions that were there. Joe.
The Senate just passed a deal to pump more than $300 billion.
Yes.
Into the Paycheck Protection Program, also some money for hospitals and testing. Don't know how much time you've had to really digest that package, but what are your thoughts on it?
So the Senate and I think all of Congress will pass a multi-billion-dollar, $300+ billion. I haven't seen the newest number. Stimulus package, small business, hospitals. It's needed. We need more, but every step they take, I appreciate. I'm not going to be picky about exactly what is passed, but we will go back and continue to push because we have an opportunity not just to save lives, but I believe to rebuild our economy, not over years, but hopefully over a much shorter time. Phil.
Any thoughts about Indiana having elective surgeries reopening? Is that something that's going to happen in Kentucky also?
So the question is Indiana and having elective surgeries reopen. We're directly talking to our hospital systems about a phased approach. I hope we can have an announcement about the very first phase of that. And we're talking to them directly about the amount of PPE needed and there even being a difference between outpatient services and inpatient services. I believe we're making very steady progress in our planning. Phil.
Governor, you've been very critical of Tennessee, as you just were a moment ago, for its reaction to the outbreak. But how do you explain Tennessee having fewer COVID-19 deaths? They reported 157, while we have 171.
Yeah, we do have more deaths that at least we've reported than Tennessee. And when it comes to deaths, I'm not in a competition with anybody. I mean, everyone across the country is a tragedy, and unfortunately here in Kentucky, we have some health conditions that make us especially vulnerable. It's why we've taken the really strong steps. But contacts, this virus doesn't care about a county line, doesn't care about a state line, and I'm not trying to be critical of any governor and their decisions, but following the White House guidance would seem to be the appropriate thing to do, since it's coming from the White House, and that's what we're doing. But everybody makes their decisions. I'm just trying to make the right decisions here in Kentucky that'll save lives. I believe we're on the right path. We've been doing the right things. We've been committed. 17 folks today is very, very hard. So again, let's light up our homes. Let's ring the bells, and let's be more committed today than ever before. We're going to leave you today with, I think it's Southland Christian Church, showing the type of social distancing that we need to, but still producing that amazing music that we all love. This is My Old Kentucky Home by their choir.
The sun shines bright in the old Kentucky home. 'Tis summer, the people are gay. The corn tops ripe and the meadows in the bloom, while the birds make music all the day. The young folks roll on the